Hello, my name is Valerie Connor, and my capstone project this semester was Essential Oils in Nursing. My practicum site was the UK Chemotherapy Infusion Clinic. Patients come to our outpatient clinic not only for chemotherapy, but also for fluid replacement and blood product replacement. There are approximately 20 nurses that staff the clinic, and there are 2 rooms, and each room has 12 infusion chairs. Patients at the clinic, they can experience a number of side effects from the chemotherapy or certain infusions, such as nausea, vomiting, anxiety, depression, general malaise, sadness, and grief. Essential oils aren't new. Their use dates back 5,000 years, being used for their medicinal properties in the Middle East and Egypt. Aromatherapy nursing roots can be traced to the Crimean War, and it's used by Florence Nightingale. They're growing in popularity now with integrative medicines. They're used now in various countries all over the world, anywhere from the US and Canada to Korea. Used topically or by inhalation. Inhalation method is the aromatherapy method. Aromatherapy is the therapeutic use of essential oils from flowers, herbs, and trees for the improvement of physical, emotional, and spiritual well-being. They provide relief from nausea, vomiting, anxiety, depression, insomnia, and pain, just to name a few. My clinical project learning objectives were first to research essential oils to find the best evidence-based practice on essential oils in the nursing field. Next, to assess UK employees' knowledge of essential oils and policies and how to obtain and administer them at the chemotherapy infusion clinic. And then third, to identify nurse-driven interventions to implement the use of essential oils with the staff there at the clinic. My goal was to interview staff with a 10-question survey to assess their knowledge on essential oils and their willingness to use essential oils in practice, to educate the staff on the information that I discovered in the literature and UK's policy and procedures regarding essential oils, and then also to demonstrate appropriate interventions and implementation of oils with staff members. My survey questions and answers were as follows. First, do you know what essential oils are? They're a natural oil extracted from a plant, flower, or tree, obtained by a distillation process. Do you know which scents essential oils are approved by UK Healthcare? UK Healthcare uses peppermint, lavender, ginger, orange, and eucalyptus. Do you need a doctor's order for essential oils? Essential oils are a nurse-driven protocol, so you do not need a doctor's order for that. Do you know where to obtain UK Healthcare's essential oils from? You would order essential oils from Materials Management. Do you know what the indicators are for use of essential oils? Essential oils are used for nausea, pain, stress, anxiety, depression, sleep issues, general well-being, and respiratory symptoms such as congestion. Do you know what screening questions are necessary prior to using essential oils on a patient? Some of the screening questions would be, do you have allergies? Do you have an aversion to smells? Do you have asthma? And are you pregnant? You would also not use on children under the age of 2 or less than 45 pounds. Do you know how to administer essential oils? Essential oils are administered by putting 2 to 4 drops on a cotton ball or a 2x2 in a medicine cup. You'd wave it 6 to 8 inches below a patient's nose while they inhale. You would reapply the scent when it diminishes or every 4 hours. Topically, you'd use 1 to 2 drops per 5 cc's of lotion, and you would apply to feet or other areas, making sure that you never ingest, and you would not apply to mucous membranes such as the eyes. Do you know where to find information on essential oils for UK Healthcare? You'd find this information on the Care Web, and you'd search for guideline number GNU-09. Have you ever used essential oils in your nursing practice? Out of 20 nurses, I was able to survey 15. 8 had used essential oils in practice, while 7 had not. Would you be willing to learn more about essential oils and their use in your nursing practice? 13 nurses out of the 15 said that they'd be willing to learn more about essential oils to use in nursing practice, and 2 said they would not be willing to learn or use them in practice. After my research and assessing the staff nurses' knowledge, I moved on to implementation. I demonstrated use of essential oils with nurses as they came to me with patients experiencing symptoms or side effects from their chemotherapy or their fluid or blood product replacements. The first time I had a nurse come to me, she had a patient that was just having a down day. I let her smell the lavender and the orange. When she smelled the orange, she smiled, and she said, "That smells just like an orange." So I put a few drops on a 2x2 in a medicine cup, and I gave it to the nurse. I instructed her to hold it about 6 to 8 inches underneath the patient's nose and wave it back and forth, and then instructed the patient to inhale. When I left, both the nurse and the patient were smiling. I consider that a success. The next time I was approached by a nurse, she had a patient experiencing nausea. And I asked her the screening questions, and she did state that she had an aversion to smells and thought that it might turn her nausea into vomiting. I thanked the nurse and patient and left. It's important to note that the patient's the ultimate deciding factor in this decision. If they think that it won't help, that's their right and their decision, and we respect that. Another member of the interdisciplinary team at the chemoinfusion clinic is the massage therapist. She comes in on certain days of the week. She offers her services to patients at no cost to them. She was giving a foot massage, so I joined her and the nurse, and I demonstrated how to put a few drops of lavender on a 2x2 and set it on the side table just for relaxation purposes. It's important to remember that the U.S. Food and Drug Administration does not yet regulate essential oils, so having therapeutic grade oils for clinical and healing purposes is paramount. Oils that enter the body through inhalation stimulate the olfactory pathways. They're closely connected to the limbic system in the body, which can regulate heart rate and blood pressure. There are 4 types of essential oils. There's synthetic, altered, natural, and therapeutic quality. Synthetic are oils that are made in a lab. Altered oils have an essential oil base, but they also have lab-created oils added to them to make them more perfume-like. Natural oils are organic, but they don't have all of the compounds necessary to be therapeutic. And then the therapeutic grade essential oils are ones that were distilled properly and retain all of their chemical compounds. Essential oils are cost-effective, they're non-invasive, they're easy to apply, they're a complementary nursing intervention. They're the second most alternative therapy used by nurses today. Essential oils can also lead to earlier discharge of patients due to faster recovery, therefore reducing hospital costs. And 80% of cancer patients use adjunctive therapies, according to the World Health Organization. A study was done using lavender oil on hemodialysis patients, and the experimental group using the lavender oil showed a significant decrease in their level of depression. Another randomized clinical trial was done on the effect of orange oil on pain and anxiety from fractured limb patients. Aromatherapy with the orange oil was shown to significantly reduce pain and anxiety in limb fracture patients. Sleep is a vital and crucial necessity for psychological and physiological well-being. A study was done in the coronary ICU in Turkey with lavender oil. The intervention group showed a significant decrease following aromatherapy with lavender oil. It increased the quality of sleep in the ICU patients with CAD. Another study was done on the effects of peppermint essential oil on nausea and vomiting in breast cancer patients receiving chemotherapy. There was a decrease in the nausea and vomiting in the experimental group over the control group that was statistically significant in the acute phase of patients receiving chemotherapy. A study was done in Korea to look at the effects of ultrasonic wave massage using eucalyptus oil on lower back pain in elderly patients. The patients filled out pain surveys before and after treatment, and there was a statistically significant decrease in pain with these patients, affirming that eucalyptus essential oil was effective in relieving pain for elderly patients with chronic lower back pain. It seems that the majority of the literature that I've read supports the use of essential oils adjunctively. The literature states overwhelmingly that complementary therapies are on the rise, and essential oils are high on the list of these adjunctive therapies. From what I've read, it seems that essential oils are proving to be effective in helping elevate moods, help patients relax by reducing anxiety, relieve pain, and increase quality sleep. Most of the nurses were eager to let me demonstrate UK Healthcare's essential oils and their uses, welcoming additional education. They had lots of follow-up questions. Their patients also seemed receptive to trying the oils, some trying it for the first time, and some had interest from information they'd received previously from friends or family members. I think essential oils are great in addition to conventional Western medicines, and the nurses seem to really be interested in using those to help with side effects. Essential oils have been available at UK Healthcare for over 2 years. Their use, however, isn't common knowledge among UK staff. About half of the nurses in the clinic had used them when they'd worked as floor nurses, but none of them had used them since moving to the clinic for work. Some didn't even know that they were still available to clinic nurses. Many had used the oils, they didn't know much about how to use them and what warranted their use. I printed copies of the aromatherapy guidelines and posted them on the bulletin boards behind the charge nurse's desk. I discussed safe and effective use of essential oils during morning huddles. I really enjoyed my time at the clinic, showing the nurses there how to use essential oils to help relieve some of the side effects and symptoms from chemotherapy. I hope you enjoyed it too.